What's going on, guys? So, I want to read a little something from a book I'm reading. Okay, so let me start from where I was at prior. So, just some ideas. This book argues why addiction is not a disease. I don't want it to be very long. This one's called, I encourage you guys to read this. I'm not done with it yet. The Biology of Desire, Why Addiction is Not a Disease. I just want to, it's already pretty good so far. Before we go any further, his name's Mark Lewis. He has a PhD in neuroscience as well as developmental psychology. So he knows what he's talking about. He's been in there. He was an addict himself. By a definition of disease, that thing, that organism, that being has lost control. The function and the structure of that thing has changed. The cell, the brain, it's a disease. So far he's actually been arguing against these programs that are diseased based. I'm in recovery. Think about, I don't know if it's semantics, I don't know the proper scientific wording for language. There's philology, but the idea that if I say this and I say this, might sound the same, but there's a distinct difference, right? I'm in recovery. It's like you're actually in it, recovery. And it makes me even question sometimes what he's saying right now at the moment. Like, are you lying to yourself when you're saying you're recovered? But he didn't use that. He says from recovery to improvement. Another book that I read, the trauma book, when you're dealing with somebody on drugs, it could have been that one or the Gabor Mate book I read. But what I remember, this is what it was. The idea, if someone's on drugs, you don't say, why are you on drugs? Or you don't try to, it's not the drug. The drug is you're there trying to help that person on drug. You're the same as the drug, because the drug is what's helping them deal with that internal thing. The drug is the external thing. Just like when somebody's giving me therapy, trying to talk to me, that's an external thing. The internal things is what we're trying to mask by the external things. Not always. I'm sure there's internal things that we mask internally as well. There are things that are internal, and maybe vice versa. We try to mask external things through externality as well. So it's, you don't tell a drug addict, like, you ask them, you don't say, get off the drug, it's bad for you, you're gonna die. You say, what does the drug do for you? You're trying to understand them. It's like when you're arguing with somebody and there's a bias there. I mean, professor brought this up to me in lecture. Hey man, you're being a cognitive dissonance, or you're being a Dunning-Keurig, or Dunning something, Keurig, or your argument sucks. So you just have to like try to explain to them, hey, can we maybe stick to the reasonings that are aiming towards a conclusion, opposed to using some sort of cognitive dissonance, or doing a red herring fallacy, using a fallacy, or using being unreasonable, right? If you want to continue the conversation, you can't use an ad hominem and a personal attack, right? It's sort of common sense. So the idea is that you don't, someone on drugs, you don't say, get off drugs, blah, blah. You say, what are they doing for you? Like, what does it do for you? Get to understand them, And then someone in recovery trying to, and this Mark Lewis was saying that these these rehabs, they love that disease, the disease labeling of an individual. Who is their product. That's their product. That's their output. That's their output, their individual. That's what they create. And they're creating, like, their job is probably not really to necessarily, they need to get your insurance money or whatever, and put you in their little recovery treatment. But that disease idea, if people don't heal, then they use that as an excuse, like, well, it's a disease, it never goes away. The structures change, the functioning's changed, it's out of control, right? So it's like, I mean, like, again, we're not for certain. We told you from the get-go this wasn't a sure thing that you were going to change, right? It's like the hospital. An empty hospital doesn't make any money. So let me give a little idea what he was saying. So most addictions end spontaneously. That is without treatment. So most addictions end on their own. So 75% of those users who came back from Vietnam quit as soon as they came back. Not all of them. That's a popular study. And some studies they did on rats. It's called Rat Park. The Rat Park study by Bruce Alexander. Alexander and his colleagues offered rats a choice between morphine solution and water. So between morphine and water. The rats who were raised isolated in steel cages chose the morphine. But once they were placed in a large wooden enclosure with other rats and socialized, they switched to plain water even when they were currently addicted. In other words, they quit voluntarily. Yeah, so this individual saying, I'm not arguing that addictive behaviors are fueled by voluntary choice. In fact, I don't see how anyone who has talked with deeply addicted people or read their agonizing memoirs can imagine that their behavior is guided by simple volition. So he's not saying it's a choice entirely. So far, trust me, I'm like barely past page 20. He's trying to get it to more, you have the power. It's not some disease that's hard to overcome. It's trying to get to see as a habit, a behavioral thing, an environmental thing, not some biological. I don't know. I'm very interested. This is just what I learned so far, and I hope you guys know. It's just like most addictions are. Most addicts obtain abstinence from without therapy, and try not to just say it's a disease. It's a disease. It's a disease. Try to look at it a different way. That it's a behavioral thing, and it's literally, I could stop. It's a behavior, not entirely a choice, but some behaviors are unconscious. So, and not to think, oh, it's just out of control. It's changed me. It's changed my structure and my functioning. But I'm gonna read right now a little bit before I go into work.